Do you have hip pain, but you're not sure what's causing it? Is it arthritis, bursitis, maybe even sciatica? Today I'll break down the 3 most common causes of hip pain and how they're different, what symptoms to watch for so that you can be able to take the right steps to get the right relief. If living pain-free equates to a better life for you, keep watching and find out what you can do to live your best life. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to become a better athlete, a more functional human, and how to age with grace using physical therapy techniques. Hey friends, it's Dr. Lindz, and in this episode, I'm going to show you how all hip pain is not created equal and how you can differentiate where your hip pain is coming from and what may be causing it. Also, I want to emphasize the importance of seeing a physical therapist or getting a second opinion if you see a surgeon who straight away recommends surgery. Please note that this information is purely educational and is not medical advice. There are many causes to hip pain, so please use this as a guide. If your hip pain persists, I advise you to see your physical therapist. Your hips are your powerhouse. When they hurt, everything from walking to sleeping gets harder. Understanding what's causing your pain is the first step to getting better. Here are 3 common pathologies of the hip that could be causing you the pain. The first cause, and we hear it all the time, is hip arthritis. And this is basically wear and tear on the cartilage inside the hip joint, often from aging, injury, or repetitive stress. Typically, it happens in individuals that are 50 or older, but if you've had a traumatic injury, it can happen in younger athletes as well. So the symptoms that you're gonna see are stiffness, especially in the morning after sitting. You may have a deep, achy pain in the front part of the hip or the groin. You'll also notice that your range of motion starts to become limited and it's harder to put on socks or cross your legs. Arthritis pain usually feels deep inside that joint and it worsens with activity. So you wanna know, will this heal normally? Yes, most of the time the cartilage heals very, very slowly and it may be corrected with normalizing your muscle imbalance. You need to learn what you can tolerate and what you can't tolerate and stay away from aggravating activities to decrease any inflammation that may be caused in that joint. The second type of hip pain could be hip bursitis, and this is an inflammation of the bursa, or the small fluid-filled sac that cushions the hip joint. Often this is triggered by overuse, repetitive activity, or muscle imbalances. What your symptoms would be are a sharp stabbing pain on the outside of the hip. It could be pain that gets worse with lying on that side, and you'll have tenderness if you press the outside of your hip. Please note that the pain is very, very localized, so it's easy to point with one finger, and it will often get worse after activity. Will this heal naturally? Yes, 100%. The bursa offloads the pressure of the hip bone, and with increased activity, weak core hip muscles, or foot problems, it can be aggravated. The most important thing to do is to rest and stop the aggravating activity to let that bursa heal naturally. The other type of hip pain that I see often is sciatica. That's the irritation of the sciatic nerve, and it can often be from a herniated disc, tight muscles, or spinal issues that put pressure on that nerve. The sciatic nerve runs right in the center of the buttock and it runs down the back side of the leg. So a lot of times the symptoms that you may have is pain starting in the low back or the buttock and it radiates down that leg. You may have burning, tingling, or numbness in that hip and leg, and the pain is often worse with some positions. So that could be sitting, coughing, bending forward. And that is very, very different from the arthritis and the bursitis because the sciatica is really nerve related. So it tends to travel down the leg. Will this heal naturally? Yes, 100%. So don't run and get surgery if that is the recommendation. Get a second opinion. There are many places that the sciatic nerve can be pinched. The treatment usually involves seeing a manual physical therapist. You may also see a surgeon for a proper diagnosis, but I highly recommend that you see a physical therapist first in order to try conservative methods before you run off to go get surgery. So to recap, here are the key differences. Arthritis will have a deep joint stiffness and groin pain. Bursitis will have a sharp pinpoint pain on the outside of the hip. and sciatica will be a nerve pain that radiates down the leg. Knowing which one matches your symptoms can help you take the right next steps. Happy hips really do mean a healthier you. If your hip pain sounds like one of these three, don't ignore it. Addressing it early makes recovery faster and easier. As physical therapists, we work hard to avoid unnecessary surgeries, and for any of these conditions, I highly recommend that you see a physical therapist prior to running straight to surgery. If you found that this breakdown is helpful, hit the like button, subscribe to Better Mobility, Better Life, and share this with somebody dealing with hip pain. Until next time, move better, feel better, live better.